Good afternoon. My name is Sharon Oliver. I'm a nurse and I'm going for my master's degree in nursing education at Purdue Global. And I am going to be teaching an evidence-based project, and it's about type 2 diabetes mellitus and also the new 2025 guidelines. Diabetes is a very serious disease. Over 38 million people in the United States have it. That's equivalent to about 1 person out of 10. And many different factors contribute to this disease: stress, diet, activity level. And so these are all things that we should look at when taking care of diabetic patients. Hello, I would like to invite all of the trauma staff, licensed nurses, to attend the online education program I put together about diabetes, type 2 diabetes, and several other factors with it. I would like to do that because right now in Greenville, there is a large cultural hub of history and contributions that Black Americans have made. And unfortunately, they have the largest prevalence of diabetes out of minorities. And so besides them, they have like 13.2% high prevalence of type 2 diabetes mellitus. But besides them, the Hispanics, the Asians, and the Native Americans also have a high prevalence. So I just want to take this time to invite you to come out and attend the online or at home, attend the online education on this. I also wanted to mention cultural humility, which is very important for us as nurses to go ahead and have with our patients who are all different, come from all different places and all different cultures. And cultural humility is a term to describe an attitude that nurses and other healthcare professionals practice to embrace the differences and preferences of other cultures using consideration, curiosity, understanding, and frequent reflection and self-evaluation. So I really appreciate if you can tell a friend to make sure that they attend the online training for the type 2 diabetes mellitus training and the 2025 new guidelines, and take the post-test and go ahead and fill out the survey. My clinical site is a prestigious hospital on the North Carolina University campus. There has been a high prevalence of diabetes, type 2 diabetes mellitus in the population. And the diabetic educator is not always available when discharging patients. That person has to go to several buildings. And so it's very important for the nursing staff, when they are discharging diabetic patients, to be aware of the new standards of care by the American Diabetic Association for 2025. Okay, some of the educational content that I will be covering today is, first of all, type 2 diabetes mellitus and the new standards of care, diabetic care in the hospital standards of care for 2025 by the American Diabetic Association, and also their older adults version standards of care for diabetes. And a brief review of some diabetic medications, and then also some of the newer medications like the glucagon-like peptide receptor agonists, and Ozempic and semaglutides and dulaglutides, and then some final takeaways. Type 2 diabetes mellitus is a result of insulin resistance and impaired insulin secretion. This results in the increased amounts of insulin required to maintain the glucose in the blood within normal limits. Diabetes type 2 mellitus is a global healthcare concern, a great impact on the economy, and also is a chronic disease that adversely affects bodily organs and systems. This is a disease that is diagnosed by a doctor, And usually if the A1C, hemoglobin A1C, is elevated above 5.7 consistently 3 times in a row, that's an indicator of type 2 diabetes mellitus or another type of diabetes. And then also if the fasting blood glucose is above 126 twice in a row, that's another red flag for diabetes. And also with type 2 diabetes mellitus, there's a lot of emphasis on the cholesterol and lipid level as well, because that could be an indicator of type 2 diabetes mellitus. Insulin has many important functions in the body. It builds protein, it promotes glucose usage, which lowers the blood glucose. It promotes lipid storage. It also enables transport of very important electrolytes like potassium, magnesium, and phosphate. Type 2 DM is very prevalent among the elderly population, the poverty-stricken populations, and also among Black Americans, Hispanic Americans, and Native Americans, and other minorities as well. Cardiovascular disease is a primary cause of death in 80% of these people diagnosed with type 2 DM. People with uncontrolled type 2 DM also develop infections easily on their lower extremities. They can also develop microvascular problems with, they get retinopathy, little veins in the eyes, and blood circulation in the eyes and the kidneys. They can get kidney disease, chronic kidney disease. And also, they can get non-alcohol fatty liver disease, or what we call NAFLD. As a matter of fact, high cholesterol and the development of NAFLD is twice more likely in type 2 diabetes mellitus. Type 2 DM is a pancreatic metabolic disorder, and it's characterized by either a deficiency of insulin or resistance of cells to it. This results in hyperglycemia, which is elevated blood glucose levels. In type 2 DM, all the insulin cells are hyporesponsive. And the receptors in the tissues, their sensitivity and responsiveness is low, and also the actual receptors are reduced. And so this results in insulin resistance and impaired insulin secretion. And this also results in a great need for more insulin just to keep the blood glucose within normal limits. The new changes for the 2025 diabetic standards of care in the hospital are as followed. There's a hospital emphasis on A1C on all patients with diabetes or with a blood glucose equal or greater than 140. However, be sure to follow your protocols, hospital protocols. And then also inpatient management of hyperglycemia is in a non-critical area is considered to be a blood glucose of 140 or more. Patients now in non-critical areas are encouraged to use their continuous glucose monitor, or CGM. And also weight loss is a priority with diabetic patients. Any kind of weight loss program that's monitored by the MD or ordered by the MD, whether it be through medication or through weight loss surgery, is a priority to monitor the patient's weight. And also there's an emphasis on improved care for the elderly. And I put the website up here if you want to go ahead and get a copy of this protocol, new diabetic standards for hospital care. The 2025 diabetic standards of care state that hyperglycemia in a non-critical area is considered a fasting blood glucose of 140 or more. In a hospital patient, a blood glucose of 70 or less is considered hypoglycemic. A normal hemoglobin A1C is less than 5.7. And there is a 4Ms framework available to help nurses now assess patients, especially used for elderly patients and in discharge process and many other processes. The 4Ms stand for mentation, medication, mobility, and matters, meaning what matters most. Is the patient going to go to a rehab to recover, or is the patient a hospice patient? And so we need to take all those factors into consideration. And the 4Ms is available at this website I have on the slide, and I also have posted another slide that has the 4Ms on it to help you also in working and coordinating and working with the doctors and physical therapists and everybody. Care of older adults, 2025 diabetic standards of care in diabetes. It's recommended that older adults with diabetes have very close assessment. Over 29% of seniors over 65 years old have diabetes. It's important to know what type of diabetes seniors have and how long he or she has been diabetic, if the patient has ever had any episodes of hypoglycemia. All of this is pertinent information. These older adults with diabetes have higher rates of functional disability, weakness, muscle loss, comorbidities, hypertension, CVAs, chronic kidney failure. All of these things need to be assessed, especially if they're being discharged. Untreated blood glucose can cause a decline in cognitive functioning and can cause falls, either hypoglycemia or hyperglycemia. Loneliness is also a psychological factor that many seniors have to cope with, and it actually causes there is a correlation between a high A1C and loneliness. Older adults should have vitamin D checked annually to make sure that they have enough vitamin D so that their bones will be strong in case they have any falls. Screening for early detection of mild cognitive impairment or dementia should be performed annually for seniors 65 years and older. There's a new clinical entity. It's called diabetes-related dementia. This is a disease that is very distinct from Alzheimer's, and it is absent of the typical signs of dementias. It's characterized by a slower progression of dementia. And some of the characteristics of this disease are slowing of cognitive functioning, having diabetes for a long period of time, high frequency use of insulin, and an elevated A1C, and noted frailty. Some medications have been shown to help these patients. Some diabetic medications that help with the diabetes-related dementia are the thiazolidinones, TZDs is what we call them. They are, and also the glucagon-like peptide 1 receptor agonists, or GLP-1RAs, and also the semaglutides. They all help. And the sodium glucose co-transporter, or 2 SGLT2 inhibitors, which have been shown, all of these have been shown to have small benefits of slowing cognitive decline and reducing the progression of dementia. The GLP-1s inhibitors help patients to lose weight by mimicking a hormone that's called endogenous, a hormone that's released after eating. It also slows gastric emptying, and it stimulates insulin production. The TZDs These medications increase insulin sensitivity in muscles and fat tissue, and 2 of these medications are Actos and Avandia. They may be used with metformin as well in combination medication. TZD meds are used with diabetic patients who don't have diabetes-related dementia also. Metformin is classified as a synthetic biguanide anti-hyperglycemic medication. There are several benefits to this medication. And it's a non-sulfonylurea which acts directly against insulin resistance. And metformin is the only biguanide used for the treatment of type 2 diabetes mellitus. Metformin works by inhibiting the quantity of glucose produced by the liver, and it's used in coordination with a proper diet and exercise to control hyperglycemia. Many anti-diabetic medications are combination medications that use metformin as a component. These medications have various side effects and adverse effects, but it's not due to metformin, it's due to the other component of the medication. As I mentioned before, 2 medications that use metformin are Actos and Avandia. Metformin has a lot of benefits. It lowers glucose, it's low in cost, and is currently being investigated as a potential anti-cancer and neuroprotective agent. So type 2 DM patients and non-diabetic people can use them. Insulin used with many diabetic patients, if using vials, the nurse opening the bottle or the vial should write the date it was opened and the date it expires. You see, Lantus and Humalog usually should be discarded in 28 days when kept at room temperature. Novolog insulin is usually stored at room temperature for 14 days. If using insulin pens, every patient should be prescribed their own pen, and human insulin should be given in the stomach for faster effects. In conclusion, it is a fact that in people who are diabetic, the hospital readmission rate is 14 to 20% higher. And type 2 diabetes mellitus is a chronic disease that adversely affects bodily organs and systems. By 2030, it is predicted that type 2 diabetes mellitus will affect 643 million people worldwide. This disease imposes a very heavy economic burden on society. The American Diabetes Association has made new 2025 guidelines and standards of care to help the various populations of diabetics. Thank you for your time. Please stay and fill out the post-test and survey. I appreciate you attending.